A lot of the procedures I do, especially if I'm fixing a valve, I would be seeing in live time on the echocardiogram where my equipment is moving. It's fairly spectacular. And I use the hybrid operating room a lot. We just had a new cath lab built. Right in front of me, there'd be 2 large screens, and you'd be looking at that, seeing the wires and tubes moving. On the screen next to it would be the echocardiogram. Often during the very complex procedures, that's a tube that goes down the throat. Everything I need for every single procedure is right here, right now. There's not a time I would have to leave here to do any case, to get any equipment. There's nothing that's not available. The facilities here are on a par with anywhere in the world. When you traditionally think about someone having their valve replaced, you think about taking a saw, cutting open the chest, called a stenotomy, and an open heart procedure.
And a lot of times people are caught between a rock and a hard place. They could either live with their symptoms and then die prematurely. The problem is the risk associated with the operation. There were estimates of somewhere between 40 and 60% of people who had aortic stenosis never saw a surgeon.
They were just not being operated on. For years, open heart surgery was the only option. And there's a procedure which we do here at Princeton, keeping everything minimally invasive, fixing that valve, and able to send a patient home the next morning. For example, replacing an aortic valve, we would now go through the leg on those patients. This is a procedure which can take just an hour long. You can advance a valve up to the heart, and this patient can go home in less than 48 hours. That patient clearly has benefited from a minimally invasive strategy.
There's sort of very few things in medicine where you have such a discrete impact on somebody's life just with one intervention, which is nice.
This is one of the biggest advances in cardiac surgery in my professional lifetime.
The bread and butter of a structural heart disease program is valvular heart disease.
The average heart surgeon in the United States does 5 mitral valve operations a year. The average heart surgeon does 22 aortic valve replacements a year. Here we do over 400 valve operations a year, and that doesn't count the interventional things, the clips and the closure of leaks. And if I was a patient, I want to go where the numbers are. There have been data repeatedly that show quality follows numbers. And if you're doing a high volume of procedures, you're more likely to contribute fewer problems.
Many of our patients come from out of state, even from outside the country, to come here. It's a very unsettling time for people. We want you to know that we understand that very well. We've assembled a kind of team in place that's going to speak to you from the first minute. Where's your family going to stay? We have a team in place that pays specific attention to that detail, because honestly I think that's just as important as the rest of the process. And I'm very proud to kind of work in a team where that's the main focus, is the patient. What we're not about doing here is just doing an operation and being done with someone. We're all about following you, being available for you afterwards. This is the way this place runs. Everyone on the same page about one thing, which is the patient.